organization found in the university. This is to promote the livelihood of different associations found in the college, such as Tanzania Medical Students Association, Tamsa, Tanzania Pharmaceutical Students Association, Tamsa, and Tanzania Medical Laboratory Students Association, TAMILASA. The conference also targets at strengthening the relationship between futures and other institutions around, such as the hospitals and the colleges. Tamsa's Futures is highly honored and would like to present their sincere gratitude to the Faculty of Medicine and the Futures Administration at large for the privilege of being the organizing committee of this past annual Futures Scientific Conference. This has been the platform for us to explore different experiences, skills in medical health, and leadership principles through consultation and positive comments received from different stakeholders we could access during the preparation time. For the time being, I'm extremely humbled beyond measures to welcome our beloved Tamsa patron. He is also the Dean of Faculty of Medicine at Futures and the Senior Lecturer of Public Health at Futures. He is going to give us a brief explanation about the event and also to introduce us to our guest of honor. Dr. Albino Kalolo, you are welcome.
Good morning, ladies and gentlemen. Welcome to the first Futures Scientific Conference with the theme of the role of 21st century health professionals in tackling the emergencies and emerging health challenges. And we have three sub-themes. The first sub-theme is antimicrobial resistance, non-communicable diseases, emerging and emerging diseases. So this theme and the sub-theme represent an important topic in the contemporary time because we are actually facing a lot of challenges. And this theme is actually expected to stimulate a lot of discussion. So up to the end of the day, we will have discussed a lot of things. So many thanks to the guest of honor, Professor Erasmus Kamugisha, the Principal of Futures, for taking your time. Professionals who have a lot of skills, analytical skills to address the various complex situations which is facing the populations, the patients, but also the health system. Because with all of these challenges, the health system cannot actually cope to address all these issues. So we need healthcare professionals who can work in a changing environment. The healthcare professionals need to be resilient because the situation is actually changing. The threat presented by communicable diseases such as HIV/AIDS, malaria, tuberculosis, and neglected tropical diseases is well recognized, and there are already several efforts. The emerging diseases such as the COVID-19 pandemic are posing serious global health security and have disrupted livelihoods and have led to economic meltdown worldwide. And poorly resourced countries like Tanzania are always at crossroads as they have a high burden of diseases and they have low share of budget to tackle these problems. The threat presented by the growing burden of NCDs in poor resource settings is well recognized as well, and the deliberate efforts are already directed towards tackling this problem at global, national, and subnational levels. The World Health Organization, especially the High Commission for NCD, has set several goals, or we could call like bold ideas on how we can tackle NCDs. The first bold idea is to strengthen the health system, address mental health. With all these problems, Yeah, there is a big burden of mental health. So that is a call to address mental health. A clear focus on nutrition, obesity, and physical exercise, because these are very important drivers of NCDs. The Commission also put an emphasis that partnerships and policy coherence among nations is very crucial. Yeah, so we need collaborations, we need partnerships to solve all of these things. But the global level goals or global level commitments can mean nothing if they are not translated locally to suit the local context. The development of strategic and action plans for prevention and control in Tanzania marks the stride forward to achieve national goals for NCD. And in our strategic plan as a country, the plan focuses on advocating for NCD prevention and control as a national priority, but also strengthening leadership, governance, sectoral collaboration, and accountability for prevention and control of NCDs. Also strengthening and orienting the health system to address NCDs through promoting preventive, curative, and rehabilitative services. Also to strengthen the national capacity for NCD surveillance research for evidence-based planning, monitoring, and evaluation. The conference theme therefore recognizes that it is the role of healthcare professionals to take lead in the control and prevention of both communicable and non-communicable diseases in the light of reaching the sustainable development goals. Yeah, so I would like to take this opportunity to welcome you all and share your opinion and commitment in this conference. Yeah, but before I close my remarks, I would also like to welcome the guest of honor, Professor Erasmus Kamugisha, who is also the principal of Scotias, here to open our conference. Thank you.
Thank you, Tamsa Patron, the Deputy Principal, Academic Research and Consultants, Professor Festus Kalogola, Deputy Principal, Administration and Finance, Professor Juvenalis Bite, the Tamsa Patron, Dr. Albino Carolo, the Chairperson of the Organizing Committee, Madam Witness John, I hope I have the right name, the second name, Dr. Edward Aman, representing the Director from TTCIH, invited guests from all institutions, good morning. It is my pleasure to be invited as a guest of honor to this first Scotias Scientific Conference. In my understanding, this scientific conference was organized by Tamsa students in collaboration with the Scotias staff. So Scotias management is highly appreciating the innovation by Tamsa students and the efforts that you have put in organizing this event. The conference theme is the role of 21st century healthy practitioners. I insist, healthy practitioners in tackling the emerging and re-emerging health challenges. This theme is good, and it requires all of us who are gathered here to wait eagerly for the presentations, discussions, and the deliberations that will come from this conference. Emerging and re-emerging health challenges include outbreaks of previously unknown diseases such as COVID-19, and diseases that were previously present at low incidence and now are increasing in our societies. I realize that you will discuss communicable diseases as part of the emerging diseases, non-communicable diseases, and antimicrobial resistance. And in antimicrobial resistance, you will discuss it in totality, including bacterial resistance, viral resistances to drugs, fungi, and the parasites. Personally, I work in this area of antimicrobial resistance. And therefore, when we talk about emerging diseases and antimicrobial resistance, we may not know the extent, but I work in the area of malaria. And we are looking for drug resistant parasites. And unfortunately, since last year, we realized that there was malaria parasites that developed the mutation in Plasmodium falciparum K15 gene, which is resistant to artemisinin. And this emerged previously in Clitomicron, Myanmar, and Cambodia, but it was not present in Africa. But since 2019, an independent emergency was realized in Rwanda, a country which is neighboring Tanzania. And up to this year, there are serious surveillances which have realized that these parasites, which cannot be treated by insect, they have started to spread in Tanzania, and especially in Kagera region. What does this translate to? It means after very few years we will be having patients suffering from malaria whom we will not have the drug to treat. Therefore, that is the extent of emerging and re-emerging diseases. Therefore, there are several challenges during outbreaks of these unknown diseases as they take the health system unprepared. Taking an example of the malaria that is not treated by artemisinin, that means we need now to look for the other drug that can treat these patients. Therefore, it catches the health systems unprepared and quite unprepared. So unprepared in terms of knowledge and skills to treat these diseases, lack of enough supplies and proper medical equipment to handle some of the complications, lack of proper drugs and vaccines to treat and prevent these diseases. Therefore, having a scientific conference at our university and specifically prepared by young colleagues, and young colleagues here I mean with our students, who are our young colleagues, because they ultimately become our colleagues if we handle them properly. Okay? Therefore, this scientific conference prepared by young colleagues to discuss the role of health practitioners in handling these emerging and re-emerging health challenges is a good step. We can now be assured that we are preparing our young colleagues to be able to respond to these challenges.